Well, hello and welcome everyone to the SHSMD webinar, 5 Essential Best Practices for Email Marketing in Healthcare. SHSMD would like to extend a sincere thank you to Powbox for sponsoring today's webinar. Before we begin, I'd like to cover a few housekeeping items. First, this webinar is now being recorded and is broadcast in listen-only mode. We welcome your comments and questions throughout the presentation. Click the chat icon in the lower right-hand side of your screen to enter your questions or comments, as we have allotted time at the end for Q&A. Please select all panelists to direct your questions to the speakers. It is now my pleasure to introduce today's speakers. Sean Dickerson is Vice President of Marketing at Powbox. He has nearly 25 years of experience in B2B technology marketing, with much of that time dedicated to helping organizations collaborate and communicate securely. Lily Ono is Product Marketing Manager at Powbox. She has over 10 years of marketing experience in various industries, including healthcare technology, telecommunications, and real estate development. Sean and Lily, the floor is yours.
Wonderful. Thank you, Tom. It is our pleasure to be partnering with SHSMD. Lily and I are delighted to be a part of the presentation today, and we are confident that the next 40 or so minutes will be a very good use of your time. So let's begin. Email marketing, it's been around a very long time. From my first email address back in, I think, 1996, to the batch and blast days of the 2000s, to the advent of marketing automation, email has been one of the primary workhorses of a marketer's tool belt. Now, like a lot of technologies, the journey has been a little bit different in healthcare, and we'll talk about that in a few minutes. But for now, let's start by focusing on what we feel is the next great frontier in email marketing, and that's personalization. So, in this day and age of extreme personalization in so many aspects of our lives, from our Amazon accounts to the online advertising that follows us around the web, it's extremely difficult to cut through the clutter with generic messages sent to broad audiences. One message that's sent to everyone, it's sort of like painting a house one single solid color. It gets the job done, but nobody's going to buy the thing. On the other hand, when our audience segment and our message come together in very personal and relevant ways, the results can be very powerful, especially when the vehicle for delivering that message is email. And here's why that is. If we go back just a couple of years to a study Forbes magazine did, it showed that there is one marketing method that has maintained its claim to fame. Email marketing still promises to deliver the highest ROI of all marketing channels, $42 back for every dollar you spend. Now, that's an ROI that's largely unrivaled among marketing activities. I guess you could make a case for search engine optimization, but the overhead involved in good SEO, from the content creation to the on-page adjustments and so forth, it's often more substantial than many marketers think. And all the while, trusty old email keeps delivering high value at a low cost. So now if we combine those two topics, email marketing and personalization, our engagement with patients and donors, suppliers, other clinicians can really begin to impact the bottom line. In fact, that's exactly what the consulting company McKinsey and Company discovered in a research study they did, where they found that organizations that are really, really good at personalization generate almost half again as much revenue from marketing activities as just the average players. And I'm sure nobody on this webinar is average, so you can imagine the possibilities. But here's the thing that makes us scratch our heads. So if email marketing can drive such a strong return on investment, and it naturally lends itself to the kind of personalization that drives 40% or more revenue than just generic messages, Why do we continue to see this? So, and let me explain what this chart is talking about. Probably like many of you, several of our team members were recently at the SHSMD Connections event in DC. And while we were there, we surveyed a lot of the attendees that came by our booth. And one of the questions we asked was this: do you personalize your marketing emails using PHI? Because it's that protected health information that is really the personalization vehicle in healthcare. What are you being treated for? What medications are prescribed to you, and so forth. Nearly 70% of those that responded to our survey do not personalize their marketing emails with PHI, despite those advantages that we discussed. And this, by the way, does not even include the nearly 20% of healthcare marketers who don't use email at all, let alone in a personalized way. So the question is why? And to begin, I want to pose that question to you, to our audience. So, Tom, if we could go ahead and kick off the first poll question, we'd like to ask our attendees, why do you think healthcare marketing teams are not leveraging more personalization in their email marketing campaigns? You can see the polling box down there at the bottom right of your screen. So take just a minute and give us your thoughts. Why is this trend of personalization so much less in healthcare than other industries? Is it compliance in areas like HIPAA? Do people feel like providers, they just don't have the skills internally to do that? Maybe they just really don't have an email marketing platform that would suffice. Perhaps the marketing budget historically has just been directed to other things like direct mail or billboards. Maybe the fund suckers, the lawyers said you can't do it, or you just don't collect email addresses. All right, let's go ahead and wrap up the poll and take a look at the results. Lily, you got any guesses? What you think people are going to say?
My guess is probably worries about HIPAA violations, especially when it comes to personalization.
Okay. Tom,
We'll
can we
find
see the
out.
results? Can we see the results of the poll? There we go. Okay. Well, you are as intuitive as you are smart, Lily, because even though it's hard to see the questions there, 71% of our audience here, and we have quite a few folks on the call with us today, said that personalization is lacking in healthcare email marketing because of concerns about HIPAA in particular and issues around compliance. Well, that is really lucky because the next slide we planned was all about HIPAA compliance. So if you would have said something else, we might have had to start over. But this is certainly true from our experience as well, in that the number one obstacle in the minds of healthcare marketers to really effective personalized email marketing is compliance. We're conditioned to think that patient portals and fax lines won't get us in trouble. But if we start sharing personalized messages in email or text, we're going to wind up, looking down the barrel of an OCR investigation and maybe some stiff penalties. But HIPAA doesn't have to stop you from employing personalized email marketing. You just have to be aware of the boundaries and work within them. And for the balance of our time, we're going to outline how you and your marketing team can do just that. So first, let's get a level set around protected health information, or PHI, what it is and how we identify it. So the Department of Health and Human Services, HHS, defines protected health information really in three ways. An individual's medical condition, physically or mentally, the provision of healthcare services for that individual, and the payment of those healthcare services. In fact, an easy way to remember it is that we have to consider the person, who they are and what they're dealing with, the procedure or what kind of healthcare services they're receiving, and finally the payment, such as pricing and billing. So those are the general areas that give us the framework for protected health information. But let's look a little deeper at some of the specific data elements that fall under that PHI umbrella. So there are 18 of them, which you see listed here. Many are obvious, like name, email address, physical address. We think of those often when we think of, hey, what is my personal information? Others we may not think about, things like device identifiers, which would be, for example, the serial number on your smartphone. Voice print identification is another element of an individual's makeup that is protected health information. And photographs, I thought this was interesting. Those don't necessarily have to be a picture of somebody's face to still constitute PHI, as long as there's some way of identifying someone. So if you marry these data elements with the person, procedure, and payment we just talked about, that constitutes PHI, and we have to treat it very carefully. In fact, that second to the last bullet that says any other characteristic that can uniquely identify an individual, that one is particularly interesting because under that definition, just being a member of an email marketing database at a provider organization can be considered a uniquely identifiable characteristic because it identifies an individual as a patient of the organization. Now, of course, when we're dealing with PHI, it must be treated with special care. Specifically, as the HHS security rules suggests, we have to employ the appropriate administrative, technical, and physical safeguards to protect that information. So where does that leave healthcare marketers? Where does that leave all of you who want the benefits of personalization, but have to bear in mind the requirements of compliance, kind of an odd couple like Snoop and Martha? It's easy to see why so few organizations are doing this today, going back to our survey. But as my colleague Lily will show you with our 5 best practices, it is possible and maybe easier than you think. So with that, Lily, we'll turn things over to you to talk about our 5 best practices for healthcare email marketing.
Great, thanks, Sean. So let's jump into those best practices. First and foremost, we need to know the rules. Sean just got done explaining that there are lots of rules and regulations for healthcare specifically that HIPAA has defined for us about the transmission of PHI electronically. The Department of Health and Human Services has added rules for marketing specifically. And let's first define what they mean by marketing, because they actually have a very interesting targeted definition of marketing. So marketing is any communications about a product or service that encourages a recipient to purchase or use. It also means an arrangement between a covered entity and any other entity where PHI is disclosed for the purpose of direct or indirect remuneration or communication about a product or service that encourages recipients to purchase or use. So to recap that, because it's a lot of words, a lot of jargon there, it just means the sharing of patient information in order to send them communications about a service, a product, or to use it to make money in any shape or form. So what's required when you send a marketing email? First and foremost, any emails with PHI must be encrypted and secured. And that's just a basic rule from HIPAA, regardless of whether or not an email you're sending out is marketing or not marketing as defined by the HHS. It needs to be secured if you're going to include PHI. The second thing is that if you're sending a marketing email as defined by HHS, you need to acquire an additional opt-in to send recipients emails, marketing emails. This is an opt-in that's above and beyond the normal CAN spam act that we're used to, where you're required to provide an opt-out opportunity, an unsubscribe opportunity to any recipients. You actually have to go another step forward and get their permission to send them anything. Now, this definition of marketing that HHS has provided is a little confusing. So it's important to understand the difference between what is marketing and what is not marketing. So because that opt-in requirement really only applies if you're sending marketing emails. So I'm going to go over a few examples here. So one example of an marketing email: informing former patients about a cardiac facility offering a baseline EKG for a certain amount of money, but not for the purpose of providing treatment advice. So this could be generic email to your entire database about information about this EKG. It's not for the purposes of specific care or treatment for that patient. So that would be considered marketing. What's not marketing is communicating to an individual about their specific treatment, including case management and coordination, or even recommending different treatments or therapies that's relevant to them. That would not be considered marketing under HHS's definition.
And Lily, can I ask a question there?
Sure.
So just to make sure we're clear, in that example, on the right, encryption would still be required because we're dealing with PHI. It just wouldn't require that additional opt-in. Is that correct?
Correct. That is definitely correct.
Got it. Thank you.
Yeah. Another example here is a drug manufacturer receives a list of patients from a provider and uses it to send out coupons or even just an ad about a new medication that they have coming up. That would be considered a marketing email. Not marketing would be a refill reminder or otherwise communicating about a specific medication that's being prescribed to that recipient. That's just general information about something they're currently using. And for a last example, a marketing email would be a communication from a health insurer that's promoting home and casualty insurance that they also happen to sell. So you're basically trying to cross-sell a different product within your own product set. That would be considered a marketing communication. Not marketing would be sending a description of a health-related product or service that the covered entity has provided to a patient. So something that's relevant to their healthcare and informational and necessary information for them about their healthcare treatment would not be considered marketing. And as Sean mentioned earlier, just a reminder, if you are sending PHI in an email communication, you still need to make sure that it is protected and encrypted, regardless of whether or not it's considered a marketing email or a non-marketing email by HHS. If you're sending any kind of patient information, any kind of identifiable information, it must be encrypted. This identifying whether it's marketing or non-marketing is relevant for that extra opt-in that's required. So let's talk about that opt-in. So a best practice here, or good practice here, is to send a warm-up email to confirm the patient's identity and offer that opt-in. So here we have an example, sending them an email. Our records indicate that this email address belongs to first name and last name. So making sure that the person you're sending this email to is actually who they say they are, and then providing them a link so that they can opt in to marketing emails or any kind of marketing communications from you. So they actually have to take action, and you can do this via email. You can also do this in person and obtain that authorization when they're visiting your practice or in any initial patient intake forms as well.
Lily, let me add one comment on this one as well. I know,
Sure.
especially with this audience, seasoned marketers, sometimes we look at these opt-in authorizations and think, well, goodness, how many people are actually going to do that? And that's true in a lot of B2B categories where those, the folks that'll opt in can be low single digits. But in healthcare, the trends we've seen are a little different. That because it tends to be a little less common for people to get offers that are relevant to their health and well-being, we see higher opt-in rates on these kind of messages than we would from any other service provider or software provider across other industries.
Yeah, for sure. It does pose an interesting problem though if you're going after any prospects who are not signed up for your services. I think that can be an extra hoop you have to jump through to get permission from someone who's not using your service to then email about your services to encourage them to join. So
Yeah, well, in that case, you just work through some disreputable email firm out of Russia or China or something like that.
yep, yep. Just break all the rules at that
That's
point.
right. That was a joke. Please, no one do that.
Yeah. All right. So let's say you have everything straightened out legally, compliance wise. Let's talk about some formatting tips, best practices for emails. Um, so first, use a send from address that's actually monitored by a human being. That's generally a good practice for email marketing, but even more so important in the world of healthcare, where someone, the recipient of your email, could actually be writing back about a problem that they have health-wise. You want to make sure that there's somebody on the receiving end who's monitoring that and actually able to route that email to the correct person to address the question. Other things include your physical address and an unsubscribe button. Those are CAN Spam Act rules and need to be there regardless of whether or not you're in healthcare. Make sure your unsubscribe button is easy to find. You don't want to further aggravate someone by making them search high and low within your emails to unsubscribe. The next one is use BLUF. So BLUF is an acronym that is termed by the military. It means bottom line up front, and it was designed to enforce speed and clarity in reporting within the military. So the basic idea is put your most important details first. Um, don't tease or delay your main point because people are busy and their time is valuable. Make sure you have all the important stuff up front so that if they're skimming and reading through quickly, they get your main point right away without having to read through lots of text. The second one, the next one, avoid TLDR, too long, didn't read. Make it short, make it snappy. Again, respect your recipient's time. It's valuable. You don't want them to read paragraphs and paragraphs. They probably won't anyway. So making it short and snappy is really important. The last one here is actually really important. The subject line in your mobile preview text are really powerful tools, and you should be spending a lot of time on these things, maybe just as much time as the actual content in your email itself. So the key to a successful email starts with two things. One is being able to actually deliver the email to the recipient. The second one is getting them to open it. And so that's where your subject line and preview text come into play. And preview text is particularly important with mobile, where you often see both subject line and preview text. And 61% of people or emails are being opened on mobile. So it's really important that you're thinking mobile first when you're writing and designing your emails, and making sure that you spend some time on that preview text. Some tips around subject line and preview text: adding a sense of urgency is really effective to getting people to open or be interested in opening. Make sure your keywords are up front, because depending on what device or what kind of display the reader has, they might not see your full subject line or your full preview text. So you want to make sure you have the meat of both of those items up front. Don't be repetitive with your subject line and preview text. The preview text is meant to be supportive of your subject line. It can include a summary of what your email is going to say. It could even include a call to action. Make sure it's working hard for you. The next thing, personalize. People love when they think a company knows them and is speaking to them specifically, and that they're not just like a number, a random autonomous or anonymous number to the company. So make sure you're personalizing the subject line preview text and talking to the person in a way that makes them feel seen. And the last thing
Lily,
is
can
just stay
I
away
can I
from,
add one thing to that?
yes,
Just
go for it.
finish your last thought, and then I have one thing to add.
My last thing was just stay away from clickbait. Nobody likes clickbait. If you catch someone with clickbait, they're going to be upset by the time they reach your email. It's not going to be effective. So that's just my last tip on that.
Well
Go
said.
ahead, John.
On the TLDR, the too long didn't read. I think it's really wise practice as you craft your marketing emails to think in terms of I'm going to have a headline, I'm going to have one sentence of text, and then I'm going to have a call to action. Rather than a tremendous amount of explanation before we get to whatever it is you want them to do, it's important to get that up front. Now, they may continue down the email and get a few more details, but headline, sentence, and then a CTA. No, don't wait any longer than that.
Yeah, that's a good point. Let them know what you want them to do up front rather than having them search through your email to find out. All right, the last thing is using the right tool. So, as I mentioned before, regardless of whether you're sending what is defined as a marketing email or a non-marketing email, any email that includes PHI needs to be secured. And that's in order to be HIPAA compliant. Uh, now, the world of healthcare has really leaned on portal-based communications as a way to abide by HIPAA regulations. This can mean sending out encrypted emails that can only be opened in a messaging portal, or it can mean utilizing your EHR system to send communications to patients, which would require a login into the EHR system to actually read the email. And portals are great for things you do once or twice a year, like updating your insurance or going into your health records to find out what immunizations you've had recently. But portal communications are cumbersome and slow. Get an email saying that you have a message, you got to click on it, log into your EHR system. It's very slow and not great for frequent communications. In fact, only 1/3 of patients use portals, and only half of those go in more than once. So half of the people who use portal-based portals just go in and register, get it done, and then never go back in again. So it's really ineffective for frequent communications like marketing communications. So consider a simpler approach to HIPAA compliant messaging. So leveraging ubiquitous email, and what I mean by that is just regular old email that you receive in your inbox that you can open up and read in your inbox. It's really important that healthcare marketing considers utilizing ubiquitous email as a main form of communication, marketing communication. But you have to do it in a way that's HIPAA compliant and minimizes risks, especially if you're using PHI in any shape or form. Unfortunately for healthcare, a lot of platforms that you're used to seeing are not HIPAA compliant. So I have a few examples here. MailChimp, for instance, says if you're subject to regulations like HIPAA, they are not liable if the service doesn't meet those requirements, which means the onus is on you to use the platform in a way that abides by HIPAA regulation. Active Campaign says, we take the stance that customers are responsible for their own HIPAA compliance. Again, the onus is on you. You're free to use the platform, but not in a way that would go against HIPAA regulation. HubSpot takes a firmer stance. They say the service is not designed to comply with industry-specific regulations like HIPAA. So we don't do HIPAA. We're going to state it loud and clear right here. So they're pretty clear about that stance on HIPAA regulation. So what should you look for in your email marketing platform? First, again, I've said it over and over, but make sure that information is secure. So you need a platform that's going to secure PHI at rest, which means that any contact data that you're storing within your email marketing platform is protected, as well as a platform that's going to encrypt and protect data as it's transmitted to the recipient's inbox. So that's while it's in transit, it's encrypted and secured from any kind of any way of getting hacked or getting out of the hands of the recipient who's supposed to receive it. The next thing you need to make sure is that you get a signed business associates agreement. That's pretty standard for healthcare. And the third is find a solution that's going to provide a seamless user experience. So that means being able to send and receive emails directly in their inbox without having to go through portal-based communications. So from there, I'm going to hand it back to Sean, who's going to talk a little bit about the world of personalization and the possibilities with healthcare marketing. So Sean, back to you.
All right, great. As she mentioned, to conclude, and I can see that we have a few questions coming in, just letting you know that we will have some time here at the end of the presentation to address those. So to conclude, let's look at a few examples of the kind of marketing campaigns you can execute when you follow the steps that Lily just outlined. So first would be drip campaigns or nurture sequences, depending on the platform you're using, that keep patients engaged along their care journey by creating personalized touch points. Now, this isn't that different than a buyer's journey in a B2B marketing scenario where prospects get different messages based on whether they're in the awareness or the consideration or the decision stage. In this case, patients receive tailored messages based on their stage in their care journey. Early on in the discussion, we could be talking about self-care or mental health awareness, then some specific preventative care measures like vaccinations, which in turn is different from managing chronic care, where you're trying to help a patient stay on a specific care plan. All the while, your provider organization, because of this care journey that you're providing, your organization is not only the trusted source for healthcare information, but you're also helping ensure patient compliance with clinician instructions and impacting public health in a really positive way. You take the data point at the right from medical economics, where they found that individualized health coaching leads to 112% increase in completion rates of treatment plans. Wonderful statistic. But with using a model like this, you're taking that and making it scalable to a large audience because you're personalizing on a large scale. I mean, if you want to reduce readmit rates or increase access to preventative care, this kind of a care journey with email at the center can be a very, very powerful element. Another use case is email outreach to donors. Though it obviously varies by provider organization, most hospitals derive a significant portion of their funding from private donations. And a campaign like this that spotlights other donors, maybe to get the competitive fires going a little bit, shares some financial results to make donors feel like a partner in the fundraising efforts, and then highlights inspiring stories can help drive both the initial and the repeat donations. And even a wellness campaign can become much more effective, 40% or more effective, as we talked about in the beginning, through better personalization. So on the left is a generic message about a smoking cessation program. But if we already know that, on the right side, that the patient or that the person is Fred and that he has Blue Cross Blue Shield insurance and that he's a millennial, although I don't know that you hear too many millennials named Fred. It would be more like Joshua or Jessica, but just, go with me on the example. If we know those things, then let's leverage them. Using the best practices that Lily outlined so that we know we're HIPAA compliant. And that's when we can really begin to make a difference. When, we're sending to a specific audience or a specific person, it's personalized content and relevant resources to that person based on, their demographic makeup. So several examples of really powerful ways that you can leverage those best practices to engage patients, donors, suppliers, clinicians. All right, now we've gone through in general principles that could apply to any email marketing solution. So indulge us here for just 2 minutes while we give you the product pitch, and then we'll get to your questions. If and all those things that we've talked about making sure we're treating PHI in a careful way with proper encryption and so forth. If you want a software solution that encompasses all of that, all of those best practices she talked about, and is 100% focused on healthcare, we'd encourage you to consider Powbox Marketing. And here's why. So with Powbox Marketing, you can use dynamic fields to personalize messages with protected health information, because every email sent is secured and encrypted and HIPAA compliant. The product offers an intuitive drag and drop wizard for building emails with a variety of customizable layouts, or you can use your own custom HTML. And recently enhanced marketing automation capabilities allow you to set up nurture campaigns and drip sequences that feature a drag and drop workflow builder, enrollment triggers so that you can start a email campaign for new list members or existing list members, time delays between emails and actions that are set by hours or days or weeks, and conditional branches to send drip campaign members down different paths based on whether they opened or clicked on a previous email. Plus, in the case of Powbox Marketing, the emails sent from our solution have an average open rate of 32% and an average click-through rate of over 5%. Now that's compared to industry benchmarks of 21% open rates and less than 2% click-through rates. Plus, almost half of Powbox Marketing customers have an open rate of 50% or higher, and some customers have seen 70+% open rates. So with that, that leads us to our last poll question. Tom, if you want to pop up that last poll question, and then we will jump into the Q&A. Like the best practices we have just been talking about, we don't want to bug you with the product stuff if you're not interested. But if you would like to schedule a no obligation demo of Powbox Marketing to see how personalized HIPAA compliant email marketing could benefit your organization, please enter in your email address in that polling box now. So just type it in and make sure you click submit, and we'll just use that to follow up with you and answer any questions you may have. We'll give everyone just a few minutes to do that, and then we will get into some of the questions that have been coming through on the chat. Looks like we've got quite a few. So another few seconds, and again, take just a moment. If obviously, as I mentioned, the principles that we talked about apply no matter what email marketing platform that you're using. But if you want something that is tailored specifically to healthcare and HIPAA compliance, then we'd love to talk with you about it. So about 5 seconds left. Again, just in the polling box, type in your email address and click submit, and we'll follow up with you after the event. And as well, a copy of these slides are going to be available to everyone following the presentation. Okay, let's go ahead and move on and start talking about some of these questions. Let's see. The first one is, what information, if any, do you have to provide on that opt-in authorization? There's a lot of flexibility in this. I'll take a stab at it, and then Lily, if you have anything to add, you can do that. There's a lot of flexibility in it. If you think about an unsubscribe or an opt-out notification you've seen, those vary from You click unsubscribe and it says this email address is opted out of anything, or you hit unsubscribed and it gives you a variety of options for different kinds of messages that you could choose to receive. With the opt-in authorization, it could be as simple as they click on that and they're taken to a page that just says, this email address would like to receive marketing messages from XYZ provider related to health and wellness. Or it could be more elaborate where you where you outline some of the kinds of messages that a patient or a prospective patient or a newsletter subscriber would receive based on opting into that. And we have noticed, as I mentioned earlier, some higher rates on those opt-ins in healthcare than other industries. Lily, anything you want to add to that?
Yeah, the only thing I would add is that you'll want to confirm their identity. Just make sure that their name and last name and email are associated with that opt-in as well. And definitely talk to your fund suckers, as Sean said, your legal team or your compliance team to make sure that you're using language that's appropriate for your organization.
Very good, thank you. All right, next question. I've read many studies that say that people want to not have to click. They want as much info as possible so they know whether to click. This is especially true in newsletters. I think we're talking about like an email newsletter where there's a variety of articles. Do you find this to be different for healthcare? Any rules for wellness newsletters? So the comments I would offer on this is yes, it's true that people want the gist of what you're offering before they click, but that doesn't mean it gets to be long. Yes, in healthcare, recipients do tend to be a little more patient because it's dealing with something that's personal and important to all of us. And, HIPAA is a two-edged sword. While it makes some legitimate outreach more difficult, it also has helped healthcare to some degree not to have the same level of, overwhelming spam offers that you might see from financial institutions or things like that. But again, yes, people want to understand what they're clicking into, but it still has to be brief. So when it comes to newsletters, you may have a series of articles there, but what we have seen is get that bluff, that bottom line up front, so that it's still a very brief headline and maybe a sentence of text, and then they can click into it. Lily, anything you would add on that?
Yeah, I would say I, I don't think there's a hard and fast rule between including a link to click or not including. I would look at the journey that you're building out for the recipients of your email. If they're at a point where they're ready to sign up for a service or learn more, then they might be willing to click because you've nurtured them, you've given them information, they're ready to take an action. Um, if you're sending them more of a like top of funnel, just information that might be useful to them, but that they're not necessarily ready to take action, then sure, your goal can be to send an email without having them click through to something else. It's more just you're nurturing them and getting them to the stage where you want them to take action. So I think just look at your entire the entire journey that they're on, and see where it's going to be relevant to include an action for them to take or not. I guess the other side thing is that if you are giving them information just that's a little more in depth, going to be very useful to them, lots of tips or information. They might want to read that in a PDF form versus within an email. So that's another consideration: is the format correct? Is it correct? Like, is the email the right place to read all of that, or is it better for them to click through to a document instead? It's all going to be contingent on what type of content you're sending out. So there's a lot of gray area there.
The last thing I would add on that question is that's one of the beautiful things about digital marketing is the opportunity to test. When we're reaching out to our email database, we rarely send a message, a marketing message that isn't split for an A/B test, that doesn't have two slightly different varieties. And if you don't have that kind of sophistication, it can just be a linear test where one month the newsletter looks like A and the next month it looks like B. But that opportunity to test will give you the best information. So, Lily, this next one I'll direct to you as our resident product expert. They ask if we collect PHI on a HIPAA compliant form, they use JotForm Enterprise. Is there a way to use Powbox to send an automated email to the practice, like schedulers, and to the patient?
Yeah, we do have an email API solution that would allow you to connect to JotForm and basically send out encrypted appointment invites or email invites to patients. So that would be the best way to do it because it's a transactional email that happens in the moment. Someone signs up for an appointment and you want to send something out right away. It's very transactional rather than a marketing email. You could utilize an API product in order to send out an appointment scheduler like that.
Very good. Next question. These HIPAA compliant and personalized email marketing campaigns all require an opt-in first? That was the question. Do they all require an opt-in first, Lily?
Yeah, so again, it goes back to that definition that the Department of Health and Human Services has for marketing versus non-marketing emails. So that's really your guide on whether or not you need an opt-in. So if you are sending them what they define as a marketing email, then yes, you'll require an opt-in. Um, but if not, if you're just sending them information that's relevant to their healthcare, uh, relevant to their personalized, individualized health treatments, then you wouldn't have to do an opt-in. Um, but one way you could go about getting an opt-in from someone who's not necessarily receiving care from you is the way in which they sign up to receive communication. So say that they are filling out a form on your website to learn more about something, include that opt-in there and then so that you can send them email marketing communications after they sign that form. So usually if you're getting their email address, they're filling out something in order for you to get that information. Include that opt-in at that point in time so that you are legally sending them messages.
Great, thank you. The one other thing I would add to that, perhaps as an example, um, if you were reaching out to an existing group of patients with a new service, kind of like the EKG example that Lily mentioned, not connected to their treatment, that would require an opt-in. However, if you're managing or if you have a group of patients who are managing a chronic condition and a new treatment possibility is available for that condition, um, you know, it's very possible that would not be considered a marketing email requiring that extra opt-in because you're already working with that patient. In the B2B world, it's sort of like you already have an existing business relationship. You're already working on treating diabetes or whatever the case may be. And so the new treatment option is very relevant to their healthcare. Let's see, are there similar regulations for employee recruitment emails versus marketing emails? So I guess by employee recruitment, maybe meaning clinician trying to attract clinicians to a provider facility or something like that. Um, if I'm understanding it right, um, the same I don't think those same rules apply when we're not talking about health information, when we're talking about business qualifications, what somebody's the kind of things you might see on LinkedIn or a doctor recruiting site. Those things typically don't fall under that definition of protected health information because it's their business area of expertise, their clinical area of expertise. Lily, anything to add on that one?
No, I agree. I would look into this is out of our jurisdiction, but any like just health HR rules around doing things like that first. But from a healthcare perspective, it's not you're not sending an email about healthcare. You're sending an email about a certain job you have open. So it wouldn't fall under the same regulations.
Right. Next question. How do you convince others in the healthcare organization that it's okay and HIPAA compliant to send an initial warm-up email to opt in using emails given during the registration process? You just do it and you ask forgiveness later. That's the best option. No, that is challenging. I would say the best way to go about it is to understand what's important to your organization because a personalized marketing email strategy has the potential to move the dial on any metric that your organization cares about. If it's patient satisfaction scores, if it's lowering readmission rates, if it's any number of financial or clinical metrics, drawing the connection between a personalized marketing email effort and the impact that it can have on those metrics is what usually helps people open their eyes. And then be vigilant and pay attention to detail when you send those messages. But that's, I think, what's worked best in my opinion. Lily, what would you add?
Um, I don't think I have anything to add to that. That sounds great. I think the convincing others is it's a skill that's difficult. But whenever you have data to back up your requests, it makes all the difference in the world because numbers are hard and fast.
Very good. Can a printed email sign-up list from a health fair perhaps serve as an opt-in mechanism? Absolutely. It doesn't have to be online. It can be paperwork where the person adds their name, where the form clearly states, I'd like to receive email messages about, health and wellness offerings, things like that, and they can add their name there, and yeah, that works just fine. Does not have to be an online mechanism. Oh, shoot. And then the last question is, can you repeat that question, please? And I don't remember what question we're referring to. So,
Sean, I sent it in the chat to her.
oh, okay.
Okay.
Great. Thank you. It looks like that is all of our questions. So last call, if there are any others. Thank you so much. Most of our group has stayed with us here the whole time. We hope you found this valuable. Obviously, we have some solutions ourselves, but again, the goal here was to provide you with some best practices that you can use and apply right away in your organization. Lily, any final thoughts?
No, just thank you everyone for joining us and spending your time here with us. And if you have any interest in Powbox, we're at powbox.com. That's Paubox. So you can Google search us or find us online. Thank you.
Thanks, everybody. Take care.
Okay, a big thank you to Sean and Lily for sharing your expertise with us today, and another thank you to Powbox for sponsoring today's program. Please complete the short survey, which will pop up on your web browser once this window closes, and a recording and the slides will be shared later this afternoon. That concludes today's presentation. Thank you, and wishing you all a great afternoon ahead.